Question number 1. A 50-year-old lady came to the surgeon with complaints of firm, painless mass in the upper lateral quadrant of her right breast. On examination, the nipple was found to be retracted. Axillary lymph nodes were also palpable and firm. She was diagnosed as a case of breast cancer. So all these points, remember, firm, painless mass, these are suggestive of carcinoma, especially when it gets adherent or fixed to the underlying tissues. And this retraction of nipple also is a sign of carcinoma breast. Then there were palpable and firm lymph nodes in the axilla also. So what are the structures lying deep to the breast? This is a simple question talking about the bed of the breast, and you know that it's pectoralis major mainly and serratus anterior, to a little extent the external oblique abdominis, and a little bit of the portion of rectus sheath. Describe the lymphatic drainage of the breast. Now this is a long portion, right? So to describe the entire lymphatic drainage, the superficial, the deep, the intercostal, and to the opposite breast, and even the shedding of the cells reaching down below to the diaphragm, Krukenbach's tumor, the secondary carcinomas, everything. Then what causes the retraction of the nipples? Now this, as I told you, this already is a sign of carcinoma breast. When this carcinoma flares up, it involves the ducts behind the nipples and the areola pulling it in. So that's a sign of, one of the sign of carcinoma breast. The others are puckering of the skin or dimpling of the skin. Now that's because of the involvement of the suspensory ligament of Cooper's. If it's a single ligament pulling it in, that makes a dimple. But if many ligaments pull a portion of the breast inside, that makes it puckering of the skin. Then what is the anatomical basis of peau orange? This is another sign of carcinoma breast where there is obstruction of the superficial lymphatics. Remember that skin do has small little ligaments beneath, and the involvement of the sweat glands. Remember, this is because of the obliteration of the superficial lymphatics, and because of the porosity of the sweat glands, the skin appears like a peau orange. Explain the anatomical basis of the spread of the cancer to the vertebrae. Of course, it lies over the intercostal spaces. So the intercostal lymphatics, intercostal veins, they spread the cancer cells into the internal vertebral plexus and even to the lymphatics reaching up the vertebrae and the intercostal lymph nodes lying on either sides of the vertebrae, paravertebral lymph nodes.